Hello, I'm Dr. Namrata Agrawal, an ICU specialist. So today's topic of discussion is stroke. Many people may be aware of what this stroke is. So for the unversed, I will discuss about stroke in detail. So a stroke strikes without any warning. One moment life is normal, another moment it is a medical emergency. Whenever a stroke has happened, it is always a medical emergency and you have to rush to hospital immediately. A stroke is a problem to the blood supply of the brain. Either that blood supply has stopped by a clot in the brain or a vessel has burst which has caused a bleeding in the brain. So stroke can be a clot in the brain which is called ischemic stroke or a bleeding in the brain which is called hemorrhagic stroke. In either of these cases, it is an emergency and you need to take the patient to the hospital, and in a hospital the patient will be stabilized first in the form of ABC, airway, breathing and circulation, and once the initial stabilization is done, vital parameters are being taken care of. Like if the blood pressure is too high, then it needs to be controlled, or the blood pressure is too low, then again the blood pressure has to be raised so that the brain damage doesn't become irreversible. Then the next step, once the patient has been stabilized, the patient will be taken for a brain imaging in the form of CT scan or an MRI. Preferably a CT scan is done because it is a fast modality and it is available in most of the places. MRI is less available in most of the places, and it may take up to 30 minutes for the MRI to get done. So if once CT scan is done, we can differentiate between a hemorrhagic or an ischemic stroke, that is a clot in the brain or a bleeding. If it is a clot in the brain, the CT scan will not show any changes. The CT scan will be normal in the first 6 hours of the incident. So if the patient has clinical signs, like if we know a mnemonic called FAST. F is facial drooping, that is half of the face is paralyzed or the angle of the mouth has been drooped downwards. A is arm weakness, so one side of the body is not working normally as compared to the another side. S is speech, speech is slurred, the patient cannot speak or makes an incomprehensible sound or cannot make any sound at all. And T is time, that is time to call an ambulance. So FAST is a mnemonic that you all need to remember, and if any one of these is present, then it's a medical emergency and you need to rush to the hospital immediately. So as I was saying, that CT scan, if it doesn't show any changes but the clinical signs are present, that means it is an ischemic stroke, that is there is a clot in the brain. As you may have heard about heart attack, which is a clot in the heart. That means the vessel of the heart which is supplying the blood to the heart is blocked. Same happens with the brain. The vessel which is supplying the blood to the brain is blocked and the blood supply to the brain is not happening and the brain is getting damaged. So that is why the signs and the symptoms comes. But the CT scan is not showing anything because it is still a reversible phenomenon, and if presented within 4.5 hours of the onset of symptom, like your symptom has started at 4 a.m. and you have come to us before 8:30 a.m. in the morning. So if you have come within this window period, then we can give some clot-busting medications and that clot can be resolved and the blood supply to the brain can be restored. So in many cases this will work. The clot-busting medication, which we call as thrombolysis, will work. But sometimes it may not work, or the patient has presented to us after 4.5 hours but within 12 hours, then we can go for mechanical thrombectomy. That is how we do an angiography and angioplasty of the heart. Same way an angiography, angioplasty and removal of the clot can be done of the brain as well. So this is for ischemic stroke. If there is a bleeding in the brain, then we have to take measure to stop the bleeding and to take care of the swelling in the brain. So either it is a bleeding or it is an ischemic stroke. If the damage to the brain has happened, it will give rise to a swelling, and we need to take measures to control that swelling and to prevent further brain damage. Thank you.